Welcome to video 1 of my core back protocol. Hi, my name is Annie and welcome back to my channel, Annie Pilates Physical Therapist. Video 1, we're going to learn about the various conditions of back pain if you have scoliosis, lateral pelvic tilt, weak core and weak back, and how to improve the mobility, stability, and flexibility of your spine to be more functional if you're suffering from back pain, weak core, and poor postures. And in this video, I'll be discussing why the core back protocol is the solution for your back pain instead of taking medications, a gunshot approach for therapy where you have to do surgery, where doctors said there's no more hope but medications or just injections on your back. And that's why I made this video series to finally feel so much better and reconnect to your core and your spine, because once you have back pain, you're going to get to this cycle of pain, muscle spasms, and tightness cycle, a never-ending pain cycle. And when your brain is clouded with pain, you're disconnected to those muscles and structures, and you cause a lot of weakness. And in this video, I'll demonstrate how to identify the weak areas on your hips and address the pelvic alignment issues utilizing muscle energy techniques that I used inside the clinic as well as in my online students. And strengthening your core can improve the posture and alleviate back pain. And once you find out which one is your weaker area, then you know how to rebalance and shift that weakness. And it's going to be a gentle approach of Pilates, yoga, and physical therapy. And consistent practice can make a significant difference. So find a program you enjoy. That's why this core back protocol is something I utilized for many years. And I love it so much. It really works. It makes a difference to my patients and to my online students. I developed the core back protocol for more than 20 years, providing lasting relief from back pain, stiffness, and poor posture. This method can help you achieve a pain-free life with a stronger core and improved posture. Finally, you connecting from your brain to the structures and areas where you're having back pain. So if you struggled with back pain and weak core muscles and you don't know where to begin, then core back protocol is perfect for you, where you can regain your life without back pain to have a stronger core, improved posture, and confidence by engaging your core muscles, mind-body awareness, and that's the focusing of breathwork and posture to slowly connect and controlled environment. Mind-body means you connect starting from your breathwork, and that nervous system regulation starts resetting, because when you're in pain, you stop breathing properly. You're going to start tensing more. And that's why the breath work is so important. So stay tuned for my next video where I'll introduce more about the core back protocol. So today it's about proper breath work to reset. We're not going to use any equipment yet for now. We're just going to start breathing properly, because in the Back Masterclass program, which is an 8-week course, Back Masterclass, in the next few days, you're going to see the early bird invitation for a first come, first serve basis. So write your name and email address. You want to make sure you receive the email reminders from me on how to start the program. And that's why we're going to find out the root of the problem. And today we're going to find the pelvic alignment. So what is muscle energy techniques? So this is so important because most of my patients with weaker and one-sided pain, their area of their pelvis is lower on the side where they have spasm and weakness. Or sometimes it's a little bit higher because they're compensating on that side. So I have patients that have both across the back pain, and sometimes the pain is more on one side that's lower because they have difficulty engaging that area. So we can assess it by lying on your back with your knees bent. Slowly roll down one vertebrae at a time. And you're going to place your thumbs on the ASIS area. So you're going to feel a bony prominence on your hips, on the top, and in this area from both thumbs. You're going to start bridging first to engage your core, and then roll down one vertebrae at a time, and then connect the both thumbs towards the middle. And you might find sides equal, but sometimes one side is lower. So this one is lower on my left side. This is my weaker side. And that weaker side, we're going to start engaging with proper breath work. As I said, before we lift our leg, you want to make sure you inhale through your nose and really expand laterally on your rib cage, because if you're expanding through your chest like this, it causes neck stiffness. You want to make sure you inhale laterally, and you're going to feel that abdominal rising, so your diaphragm is shifting down. As you breathe out, you want to make sure you zip it up from your lower abs to your navel. So when you zip up from your lower abs to your navel, you're not going to bear down to your pelvic floor. Again, take a deep breath, expand, and then breathe out. Exhaling through your mouth is so important, so you have that piston motion suction from your pelvic floor, lifting, because with the core engagement, your core muscles is not just your abdominal muscles, but there's more deeper structures from your diaphragm as well as your pelvic floor. So as you inhale, expand, exhale, you want to zip it up from your lower abs to your navel. And breathe out. Inhale, exhale, breathe out. We have 2 more deep breaths. Last one. Exhale. So the breath work is so crucial, so that when you inhale, exhale, and at the same time, keeping your spine in neutral position. So this is when you're going to place your hand at the small of your back and one hand on your abdomen, because you don't want to be overarching where you can already place your forearm at the back. You want to make sure it's slightly arched, but not overarching where your pelvis is anterior pelvic tilt. So most of my patients with anterior pelvic tilt, they're compressing that lumbar spine. So if you're overarching, slowly press your hand against your back against your hand. But if you're flat back like this, then do a little bit tilt, which is normal for a little bit lordosis. Each one is unique on their postural alignment as long as there's no pain. But if you're having pain, then that's when you have to reset your body. And now from this, if this is your lower side of your pelvis, that's when we're going to start lifting this weaker area. So in order to do that, lift your knee to tabletop to 90 degrees bent with your knees 90 degrees towards your hip. Not too high or not too low. So if you notice, this is like a top of the table, which is your leg. If you place a cup of coffee, you don't want to spill. And then at the same time, if you place a cup of coffee on your stomach area, on your abdomen, you don't want to keep it spilling to the left, to the right, to the front, down if you're anterior pelvic tilt, or towards your chest if you're posterior pelvic tilt. That's why it's nice to keep the cup in the center and then hold that position. Place both hands on top of your thigh. As you inhale, expand your abdominal muscles. Exhale, press against it. And you're going to feel a deep ache on your hips as long as there's no pain radiating down your leg, which is a sciatica symptoms. So again, inhale, exhale, press. One breath, and then relax. You can do up to 2 deep breaths just like what I did, and that's around 10 seconds hold. So we have 9 more to go. Tabletop, place your hands. As you inhale, exhale, press. Inhale, exhale, press. And down. So up to 10 reps, you're going to do this side. Now, on the area where you're elevated on your hips, interlock your fingers, place it behind your thighs, and this time, instead of pressing towards your chest, you're going to pull your leg away with your interlocked fingers behind your thighs. So this helps your pelvic tilt go down on your opposite side. So if my right side is higher, that's when I'm going to push down and take a deep breath. Exhale, press down and breathe out. Again, inhale, exhale, press. And then rest. So at least 2 deep breaths. That's around 10 seconds hold as well. And do that 10 repetitions as well. You might feel some deep ache on your back or in your hip groin area as you breathe in. Breathe out, press again. Inhale. Exhale, press. And do that 10 repetitions. The next exercise, we're going to glue them together by placing your hands, or you can use a foam roller or a ball or a pillow between your knees. For beginners, it's nice to keep your feet down, or for advanced level like me who has a stronger core, with my knees up, both hands, interlock my fingers like this in a fisted position and place it between your knees, and I'm gluing them, engaging my hip adductors, and the mirror of your pelvic floor is your hip adductors. So take a deep breath. Exhale, press against your fisted hands as much as you can. And if your hands are starting to hurt from the pressure of your thighs, foam roller. This is a very soft foam roller. And press against your knees and your feet. And this is actually amazing. This is soft. And I just launched my foam roller. Click the link on the description below. You can get access of my lovely foam roller. Breathe in, breathe out. So it's like 2 deep breaths. And if that's too challenging, with your feet down, you can do it as well. And for absolute beginners, and compress against the foam roller. And you're gonna feel a deep ache on your pelvic floor if you're very weak in that area. So take a deep breath. Exhale, zip it up. Don't forget to, it's like a zip up motion. And press gently. Inhale and exhale. And then relax. Again, we have one more. So my recommendation is to do 10 repetitions as well. Breathe in, breathe out, press. Inhale, exhale, press against the foam roller. It's actually look easy, but you're going to feel some deep ache that you never thought. It's very deconditioned and weak, especially if you're having back pain. So after gluing it, engaging the hip adductors, now we're going to engage your hip abductors. So with your knees bent to double tabletop, 90-degree bend, place your hands on the outside of your knees. As you breathe in, breathe out, slowly press against your hands. So I'm opening my knee out without movement, so isometrics, and breathe out. And if this is causing pain on your back because it's too challenging on your weak core, lower your feet down, and then if you can reach for your knees and press against it with your heels up. Or heels down and press against it. And if you can't reach on the outside of your knees, my recommendation is grab a belt and make sure it's really tight and press against the belt. Press against the belt out. Making sure you're really bracing your core as you breathe in, expand, zip it up, and press. And do that 10 repetitions as well. I'm hoping you enjoyed my lateral pelvic tilt alignment. And if you don't have a tilt alignment, you're going to feel the weakness. You can do both hip flexors at the same time if they're aligned but you're having back pain, because usually weakness on the hip flexors, you need to engage them as well. Your hip extensors, you can do the front and the back of your thigh, left side and right side if you don't have a tilt when you measured it. I'm hoping you enjoyed this lovely core back protocol video 1, and I'm hoping to see you on my video 2. So don't forget to sign up with your name and email address down below if you haven't signed up for the early bird, as I'm gonna open my back masterclass very soon. So you're gonna receive an exclusive invitation email from me. And video 2, so be on the lookout. It's going to be a lot of not just the proper breath work, but finding out the neutral spine and how to strengthen your glutes, activating Pilates using the proper breath work, neutral spine, and slowly improving the lower abdominal muscles, your hip flexors, and your glutes. Until my next video training, always remember, be safe, be well, and healthier you. If you have more time today, this is another core back protocol video that you can check out today. See you next video training. Bye.